The next generation Ilias tube collection of our technology. First finger tip bending mechanism provides a choice of a new intubation technique.
The tip bending mechanism allowed the smoother deep part insertion. It relieves the burden of both healthcare workers and patients by insertion and exposure time reduction. When a tip is bent, it is aimed to become easier to insert in the scene of explaining below. Tip may proceed to stomach the vault section in the stomach, and it is slow progress in pylorus direction. By bending a tip and using a torque, it is possible to make a tube tip turn to in the direction of the pylorus. By bending a tip and hanging a torque, it is possible to make a tube tip to turn to the pylorus. It is possible in the bent section and the ring-shaped folds, when a tube tip is caught, passing it by bending a tip. Connect a catch tank to flex controller, and suck out the sterile distilled water into the cylinder by pulling the handle. Switch the lever to the flex side, then connect the controller and tube. Rotate the plus side, the handle clockwise, to make sure the bending of the tip. If the bending response is slow, air vent at the controller connection lumen. Attached to the controller connector, after suck sterile distilled water of about 3 ml to 20 ml syringe. Suck the air, and filled with sterile distilled water. Also, hold for 2 minutes with keeping the maximum flexion tip. The tip The tip will bend gradually when the handle is rotate the plus side clockwise. When the handle is rotated the negative side counterclockwise, bend is released gradually. If the lever is switched reverse, bend is released at once. Sterile distilled water will discharge to catch tank if the pressure of more than specified is applied to the controller. It is the maximum flexion tip when it is discharged to the tank. Stop operating the handle. When there is much drainage to a tank, the sterile distilled water in the cylinder may be short. Add sterile distilled water into the cylinder at any time. If the tank is filled with water, remove it, and discard the sterile distilled water. This case is a case of post-surgical adhesions Ilias. After inserting a tube into the stomach, it has gone toward the fornix when forge ahead as it is. A direction towards the gastric smoothly, and it went into the pyloric antrum by bending a tip. About the passage of the pylorus ring, the tip direction towards to the pylorus relatively easily, by bending a tip. It was able to be past the pylorus, in a relatively short period of time in a result. A tube tip would be caught, by the mucous membrane folds in a small intestine bend section. There is a case, so that is not suitable in the direction to push forward well. By discerning directivity, using contrast media and changing the directivity slightly, the power at hand came to get across to the direction of the tip, and it was able to pass the bend section. Please be sure to read through the instruction for use attached to the device before use. First finger. Tip bending mechanism provides a choice of a new intubation technique.